Hello, so welcome to our third explanation, our third type of explanation of schizophrenia. And this one is a social psychological one. So this explanation is one that's going to explain the causes of schizophrenia in terms of the people around the person who has schizophrenia. And as you can imagine, families are going to be involved in that. And the one that we're going to look at most is a dysfunctional family explanation of schizophrenia, and we're going to look at that based on the fact and the theories based on two main sections. The first section is to do with double bind theory, which is something that happens to the child, and then and that's regarded as an explanation for the cause of schizophrenia. And expressed emotion is to do with causing people to relapse. So people who have recovered in between episodes and relapsing. We'll see more about that in a moment. So your task and the focus today is to understand the dysfunctional families explanation, to realize that the double bind theory is about the cause of schizophrenia and that the expressed emotion part of the theory is about the relapse of patients. Okay. So your task while we're doing this, and again, this needs to be done, if not by the end of the lesson, by the end of today, is to complete the A1 section of the summary sheet for this dysfunctional families explanation. Okay, so if you have it as an example of what can happen within families, imagine you've got this example where the mother tells the son that they're not affectionate enough, but when the child shows affection, the mother pushes them away and says something like, "Grow up, you're a big baby." So there are two different contradictory messages going on there. So and small children in particular have difficulty with those, and they can't do much about it. They're stuck with their parents. They live with their parents. They can't leave the relationship. But they've got two different messages coming on about you should be affectionate and you shouldn't be affectionate at the same time. So according to Bateson, who came up with this theory, it's quite an old theory, as you can see, in 1956, then the situation becomes what's called a double bind situation. And what that means is that the child feels that they can't behave in one way or the other of the two choices that they have, because whatever they do, they're going to be going against their parents' apparent wishes, but they don't really know what the parents' wishes are. So, the child can't tell can't really work out the conflict, and sometimes people say one thing and with their body language show something else, and as a result of that, the child doesn't know what to believe. Okay, so that leads ultimately to an internal state of conflict, and as a result of that, it creates what Bateson describes as it stops them developing an internally coherent construction of reality. So inside their head, they're not able to have a picture of the world that makes sense. So, for example, a picture of the world that would make sense would be a parent who shows affection, and every time you come across the parent showing affection towards you. This is in an ideal world. Obviously, not all parents are human too. And then the child would know, oh, it's my parent. I can expect affection. But if the child experiences a situation where they're being told that the parent has affection, but affection isn't being shown, then they can't make sense of the world. Okay, so the idea is that the family that they're living in and the relationship with the parents that they're having means that they can't make sense of the world. It doesn't make sense. And so if you've got a world that doesn't make sense, Bateson says that what happens is that the child loses grip on reality. And what happens is that they've internalized this feeling that the world doesn't make sense. And because of that, and because we've got a sort of drive to try and make sense, the child then escapes from the world into this and escapes from the double bind into their own world, a world of delusions. So when we think of the symptoms of schizophrenia, hearing voices, for example, that say things that would fit in with that. Delusions, where we make we try and make interpretations of facts that don't make sense. So that's the theory, as that schizophrenia is simply an escape from a world of double bind into the person with schizophrenia's own world, which is full of delusions and hallucinations. Okay. So expressed emotion. This is an interesting idea, and this is like the second part of the dysfunctional family explanation, and it explains. It's not so much focused on how parents respond, but it's how people in the family as a whole respond to one another and interact with one another. So it's a measure of the amount of emotion displayed, and it can be measured. There are a couple of measures that I'll explain in a minute. It can either be the Camberwell family interview or the 5-minute speech sample. So this theory suggests that if a family is high in expressed emotion, it's a high level of expressed emotion within the home, what that means is that it can worsen the prognosis, the outlook for the person with schizophrenia. It says it will increase the likelihood of relapse and readmission into the hospital for patients. So the reason this theory came about was because people were seeing that there was some patients were being stabilized with drugs. Chlorpromazine was the principal drug, but we'll talk about that more in the later in the course. People were being stabilized with drugs, but then when they were going back to their families, they were, some of them were relapsing. And theory came about that the families that were most likely to cause a relapse were the ones that had this thing called high expressed emotion. And high expressed emotion is made up of 3 different dimensions, or 3 sections, if you like. So it's a family with a high level of hostility. So that's a negative attitude directed to the patient. Okay, and so it's a family maybe who thinks that the person with schizophrenia should be able to control themselves, and then making a choice not to get better. And so the family saying, okay, as a result of that, look at all the problems that you are causing, and they're for this family, and it's all based on your behavior, and your behavior is something that you can choose. So if that is being expressed, imagine that you're someone with schizophrenia and you're returning to a family where they're expressing that type of emotion towards you and that type of hostility. Again, we can understand why that could that stress could cause a relapse. Another thing that we have is this idea of what's called emotional over-involvement, and so this can almost be the other side of the coin, where in actual fact the family is so involved, they blame themselves for the patient being the way that they are, and even though it is the opposite of a hostile attitude, it still has the negative effect of causing stress on the patient, because the patient feels guilty about making their family feel that way. So again, as a way of dealing with that, or a way of avoiding that situation, the person relapses into schizophrenia. The final dimension is simply critical comments. So again, we have a situation there where people talk about the patient in the family with schizophrenia in a way that, even though they know it's not the patient's fault that they're behaving in the way they are, they're still critical about the way the patient's behavior has influenced the family, and that can come from parents, and it can influence siblings. So again, we can see that these are 3 different ways where someone who's got who's got the possibility of relapsing into schizophrenia as a result of stress, that these are 3 ways that stress can actually make that person relapse. Okay, so again, so you can imagine that if you're living in a family where you're relying on people for support, and instead of support you're experiencing criticism from them, then we could see how that might be an issue. And as a result of that, what was being noticed was that people with schizophrenia were going into hospital, being treated with drugs, getting stabilized, going back to the family. After a while with the family and the criticism of the family and those bits of expressed emotion, they were then going back into hospital, and there's this cycle of what they call rehabilitation and relapse. Okay, so the way to deal with that, and the way to avoid the cycle is actually, instead of just focusing on the person with schizophrenia, but getting the whole family to go through some kind of intervention together, so that they can work a way out of reducing the amount of expressed emotion within the family. Okay. Just a little bit on how we measure expressed emotion. And again, this is useful information. You don't have to mention too much about it, though. So one way is to use a 5-minute speech sample. So you ask each member of the family to talk about the person with schizophrenia and their relationship with the person with schizophrenia for 5 minutes, uninterrupted. And then you just record what the person has said, and then you code it for the overall level of expressed emotion. So, and the way it's coded is that it's said that if the person in that 5 minutes is given one or more critical comments or negative comments about the relationship, or a critical statement at the start of the interview, all of those are indicative of a high level of expressed emotion. Camberwell family interview is similar in some ways. And again, so you get the patient's close relatives present. You don't have the patient being there. And the interview focuses on things like stress in the household, irritability, participant with the patient in routine household tasks, and they're asking all of the members of the family about how the patient is actually functioning within the family and what they're doing. Okay. And if a close family member makes 6 or more critical comments, or any statements that are rated as hostile, or shows any indication of the other thing we talked about, which is over involvement, so taking responsibility for the person's schizophrenia themselves, all of those are classified as being high in expressed emotion. Okay, so hopefully there, using the information that we've got there, and there's also some good information on page 122 of your textbook. So can you please use that information to complete the first bit of your summary sheet on social psychological explanations of schizophrenia. Nice to see you. I hope the volume is a bit better on this one. I've got the microphone very close to my mouth, and hope that's made a difference. Okay, speak to you soon. Take care.